The term ACE is an acronym for Adverse Childhood Experience and refers to various traumatic circumstances or events that impact children before the age of 18. There are 10 types of ACEs that fall under the categories of abuse, neglect, or household dysfunction. The impact of how these traumatic experiences can affect our long-term health has been a focus of many studies since the mid-90s. These studies have determined that there is a strong and persistent correlation between the higher number of ACEs experienced as a child with a greater risk for physical and mental health concerns later on in life. The negative impact that adverse childhood experiences can have on our long-term health is a topic that has been well researched over the last 20 or so years. And while not fully understood, many of the leading causes of death here in the United States are strongly associated with adverse childhood experiences. The U.S. Center for Disease Control has connected experiencing an elevated number of these experiences with an increased risk for developing over 60 different physical and mental health conditions. Just a few of the more severe health consequences that are associated with adverse childhood experiences are cancer, diabetes, strokes, high blood pressure, obesity, respiratory disease, and premature mortality. Mental illness is also connected with experiencing an increased number of adverse childhood experiences as well. Researchers have documented a strong correlation between those who have experienced an increased number of ACEs to an increased odds for clinical depression, anxiety, and increased suicide rates. A child with a high ACE score has been proven to be at an increased risk of developmental delays, behavior issues, learning difficulties, and serious health issues. The main function of ACE screening is for the professional to identify the likelihood that someone may be dealing with what is known as toxic stress physiology. Clinical assessment, including protective factors and ACE-associated health conditions, are all a part of a complete ACE screening as well as the ACE survey. The Adverse Childhood Experiences Questionnaire used in the screening process measures if children have been exposed to any of the 10 separate adverse childhood experiences. Those individual experiences are physical abuse, sexual abuse, emotional abuse, physical neglect, emotional neglect, parental separation or divorce, domestic violence, a family member being incarcerated, a family member dealing with mental health issues, and lastly, a household member with a substance abuse problem. A person's ACE score is determined by adding up the number of these ACEs that they have experienced. A yes response has a score of 1, a no response has a score of 0. The sum of these responses is your ACE score, or sometimes referred to as a trauma score. If the ACE score is 1 to 3 without ACE-associated health conditions, the patient is considered to be at an intermediate risk for ACE-associated health concerns. If the ACE score is 1 to 3 and the patient has at least one ACE-associated health condition, or if the ACE score is 4 or higher, the patient is considered high risk. These scores are only meant to be an indicator if a person is at a greater risk for ACE-related long-term outcomes. Not all children who experience multiple ACEs will have to live with poor outcomes, and not all children who experience no ACEs will avoid those poor outcomes. There are a few important factors that aren't considered when screening for ACEs, such as the ACE screening doesn't take note of several other adverse experiences that could affect a child's development, such as stressors outside of the household like poverty, racism, bullying, community violence, loss of a close friend or relative, isolation, a chaotic environment, lack of services. All of these factors can affect a child's health. It also doesn't take into consideration some of the things that help to buffer out the toxic stress, such as if they have a strong support network of adults that can help them to build their resiliency and to help them cope with the stressful situations.